He comes in with this specific problem. I just have really bad breath. What are some tips you can give them without actually going into a lot of treatment?
Right. So one of the most common reasons to bad breath will be, of course, if there's a lot of plaque on the tongue.
What's a top misconception about veneers that you hear all the time?
One, turning teeth into little nubs, little pegs, and I think the term was turkey teeth from what someone mentioned. That's something that unfortunately is not the case. Not to say that it's
Our audience listening who doesn't know anything about your industry, are you taking photos of a patient, putting that into your computer, and actually designing as if some architect was designing your house, and then doing those treatments?
so I like to take at least 12 different shots. Right now, each shot can be I might take 5 of them. Might even take more. So I like to start off by taking lots and lots of pictures from the face shots, from the smile, everything being retracted, the side shots. And once I take all these shots, I'll actually like to upload them into a PowerPoint.
Welcome, Doc. Thank you for coming on the show today. How are you?
Doing very well, my friend. How are you doing today?
I'm good, thanks. Let's get into a little bit about your childhood. Tell us what you were like as a kid.
As a kid, as a kid, I was I always liked to see myself as an outlier. I remember being in high school, having earrings, having like lines on my hair. My shirt was a little bit more too big than what it should be. So, but when it came to school, I studied so hard, Fridays, Saturdays, Sundays, and I would do my best to do very well in school. So the teachers were confused. They're like, "Who is this guy that is doing well academically, but he looks like the way he is?" So I always saw myself as a misfit, and that's something that stuck with me over the years, and even to this day, I do see myself as a misfit as well, and it's just something that carried on over the years.
Interesting. The word misfit, is that, do you do you feel the world doesn't get you, or do you feel in another way? Because the word misfit could be anything. Like, a lot of people think I'm a genius, everybody else is an idiot, I'm a misfit, and they will die on that hill, right? And I know such people, and they truly are incredibly smart, right? But how do you define the word misfit in your life?
Me, a misfit alludes to being different or being felt or being misunderstood. A lot of the times, someone who is also unpredictable as well. And I think to answer your question, I would maybe label myself as someone that's a little bit more unpredictable, more than a misfit. So I don't know if that answers your question, but that's how I would. Yeah.
Awesome. When did you decided you wanted to be a dentist?
So this started years ago, at the age of 14, actually. So I remember I didn't have any dentists nor any doctors in the family, but I did shadow the mom of a friend back then, and I would go in on Saturdays, every Saturday morning. The clinic was open, and I would just sit there for a couple hours with my little notebook, and then just write everything I was learning. So. And I think to answer your question, circling back to it, what made me want dentistry really stemmed from that moment when I saw the confidence that was being changed from all the smile makeovers. And back then, cosmetic dentistry was still fairly new, but after seeing the change in confidence in people's smiles is really what fueled my motivation to wanting to become a dentist, specifically a cosmetic dentist.
That was going to be my next question. Did you know when you started studying in medical school that you wanted to be a cosmetic dentist and not just, take out molds?
Yeah, yeah, of course. I mean, aesthetics has always been my passion, and the reason for that is because I grew a lot in the fitness industry, where I would compete in men's physique, and physique competitions. You're really putting a preface on symmetry, proportions, discipline, and that idea of aesthetics, that sculpting, um, stayed with me over time. Now, when I was an undergrad, I was debating whether I should go into plastic surgery or to cosmetic dentistry, right? So both of them have a lot of aesthetics and science, and that comes into play in art. But eventually took the dentistry route, and with the eye of aesthetics, I knew that this is really what truly made me happy. So I wanted to take on the lead and specifically focus on aesthetics.
So for our audience that's watching you, they can tell you have like the best looking teeth ever. But for people listening, right? I I wanna make sure everybody understand what you do is not specifically being a dentist, and people don't come to you when they're in pain, right? How would you describe what you do?
Right, right. So, I don't look at cosmetic dentistry and general dentistry as two separate entities, right? I look at it as one being an umbrella over the other. So to me, when you're doing a filling, something as basic as a filling, right? It could be the most aesthetic filling ever, right? But in my mind's eye, what I do like to focus on are smile enhancements, right? When you're changing someone's teeth, someone's smile, you're making their confidences better. So even though I do a little bit of general dentistry here and there, I do try to put most of the focus into cosmetics, whether if it's in Veneers, Invisalign, Botox, and then try to intertwine all that together. It doesn't mean they don't have cavities. It doesn't mean they're not in pain. I think all these things need to be addressed as well, but I try to focus more on the aesthetic part of it.
But most of your patients come in because they want to look pretty, not because they're in pain, right?
Right, right. So yeah, most of them come in, or a little bit of both, where they might have pain, might have discomfort, but they also want to look good. So I tailor a treatment plan that can kind of kill two birds with one stone. So it's very a patient preference on where they're at.
Do you remember your first smile makeover you did?
Oh yes, yes. I actually remember it very well. It was a patient that came in, one of the most incredible patients, so sweet, so nice. He would always wear a leather jacket, had a motorcycle. And I remember when he came in, he had multiple crowns already. They were all different colors, and he didn't specifically ask for cosmetic dentistry. He didn't really ask for veneers or crowns or anything. He just came in, did a little bit of work, and I sat with him and I'm like, hey man, like, have you ever considered so and so and so? And he didn't even know it was possible, right? So, and back then, when I remember taking photographs of his smile, and he didn't know how to smile, because every time he would speak to me, he would have his hand up because he just wasn't happy with the smile, right? And I remember a very interesting time where when I was trying to take pictures, and he didn't know exactly how to smile, which was a very interesting process because as we went forward with the treatment and then started putting him on temporaries, it was a very interesting dynamic and seeing how things have progressed from the moment he started and his level of confidence where he was putting his hand on his mouth until the temporaries where he was starting to open up more and learning more how to smile. And then when I saw him just recently, he had so much energy. There's a lot of positive reading energy that I don't even know where it came from. And he didn't have his hand up anymore. He was smiling very confidently. And my gosh, the level of confidence that this guy had was incredible. And this really, truly was a incredible experience. But yes, that was my first patient.
When I was preparing for our podcast last couple of days, I've been doing research, and in my head, I'm thinking you're you're like a rich people's dentist, right? People come to you because they want to look good, they want to smile better. But now that you've mentioned this case, this could be life changing for someone who's lacking confidence because of their smile, right? Do you? I was just gonna say, do you get patients that they're well off, they're doing good, they just want to look better? Or is it more you're treating patients because they're underconfident because of their smile or the way their teeth look? What's most of your patients?
So it's definitely the latter. I think it's a huge myth when people say that cosmetic dentistry is for the rich and famous. I think we can
Right.
we can always find ways on tailoring it specifically to people's finances. And when people think smile makeovers, it's not just veneers. right? It could be anything as simple as a whitening. It could be just a little bit of bonding, right? It could be things that are very, very simple, and it's not just veneers, right? So I wanted to clarify and to answer your question. Yeah, I mean, we do get a decent amount of like celebrities and people who are highly well off, but we also get people who are on the other opposite of the spectrum, and we tailor everything based on people's needs. So it doesn't matter where they are in the socioeconomic status ladder. We treat everyone equally, and we treat everyone based on their expectations and needs.
You said when we were talking about this patient of yours, you said they didn't know what was possible. So, for an average person that's listening to the podcast, what is possible for them?
Yeah, I mean, everyone's starting point is different, right? Someone who comes in and has already has crowns everywhere, whitening wouldn't work, right? Because the whitening itself is not going to turn the crowns whiter, right? People
Right.
who have misaligned teeth um, may need different types of treatment than someone who has perfectly straight teeth or with a good bite. So everyone's expectations need to be clarified at the beginning of the appointment. Because as dentists or as cosmetic dentists, we can bring you to that perfection. It's only a matter of having that conversation with patients and seeing, okay, what is your timeline? What are your expectations? And are you okay with so and so and so to get you to that point, right? So everyone's
Right.
starting point is different, you know? Biology is different.
You're in Beverly Hills, California, right? A lot of our patients or the audience is in the state side. What is an average person spent at your clinic, if you are willing to share that? The reason I ask is because sometimes people listening to this might be like, this sounds fantastic, but if it's like $20,000, I can't even think about it, right? Do you have anything you can tell us about what a layman living in Ohio should be looking to spend when they just want to, you know, look better because they're under contract? Yeah,
I mean, we have people
like,
that travel all the time from different states, different countries, and I think my first question is, how long are you in town for, right? But to answer your question in terms of finances, it everyone's need and expectations are different, right? Someone who
right,
has nice teeth and they have a lot of enamel, honestly, with a little bit of whitening would be fine, and that doesn't cost more than a few hundred, you know. So it's everyone's starting point is just so different, you know. But as far as finances, it could be from a couple hundred or it could be a couple thousands, you know. It could be it's just everyone's needs and it's just different, you know. But as far as to give you numbers, again, it's very specific to the patient, but you know,
right.
it varies a lot based on where they're at, right? And
That's fair.
you know,
Do you consider your work to be more medical, or is it more artistic? Is it more emotional? Is it a little bit of everything?
yeah, it's definitely a little bit of everything, and the reason for that is because when you're designing, say, veneers as an example, right? There's a
Right,
huge artistic element to it. You don't want just an opaque tooth, right? You want there to be different gradients of color, different shapes, different sizes, the anatomy, the grooves. So there's definitely a really important artistic element to it. Now, for that veneer to last, we also have to take into consideration the medical part as well, right? Longevity is something that's very important, right? When you get work done, you don't want it to just last months or a year. You want it to last years and years and years. So, and if you don't take into account the medical part of it, the bite, the function, then the veneer will fail. It won't last. So, to answer your question, there's also a very important medical aspect to it. And of course, when you're changing someone's teeth, someone's confidence, then emotionally, it is life changing as well. So it really, circling back to what you're saying, you're really hitting all those three stones, you know?
when a new patient walks in, what's the first thing you're assessing when you're looking at their smile makeover?
Yeah, I've definitely in terms of expectations. You know, it's very fun and gratifying for us to bring someone's smile from here to here, right? Even here.
Right,
But it's very important to sit down with the patient and have a clear idea of their expectations their needs. Is even possible what they're asking. You know, I've had patients come in with pictures of celebrities or pictures of other people, and they're like, "I want this," but I'm like, your biology is very different than that. You know, your gums are very different than that, and I can show you ways where we can tailor it to specifically to make it look similar to it, but it won't be look identical because everyone's different, right? So
Right.
I think to answer your question, expectations, and that's what I'm looking for to see what is it that they want and how can we get there.
Do people really come in and they want to look or smile like a certain person? They're like, that's how my smile should be.
More than you think. I've had patients,
What's the most common celebrity smile that you get?
definitely Haley Bieber.
Really?
Yeah, pictures of the teeth, pictures of the
Interesting.
proportions. You know, it's funny because I've had even patients come in and one in particular that brought a binder with pages and pages of front shot pictures of what he used to look like, where he is at now, and what he wants tweaked, and then he drew with pencil all the things he want tweaked. And I actually appreciate it because I'm like, all right, you made my life a little easier because now I know what you want. But I've never seen anything like that before, and this so that's definitely hands down one of the most extreme cases. But we definitely get that a lot.
I was gonna say, when people come in expecting a certain smile, is your aim trying to give them what they want? Or are you sometime telling them, you're just ugly, that's never gonna happen, you know, let's look at other options? Obviously not using those words, but you know what I mean.
Yeah, I mean, everyone has his own true beauty, right? And I'm a firm believer that what makes it smile perfect is the imperfection, right? It's really the imperfection, the asymmetries that make someone smile look very aesthetic, very natural. I mean, there are times where I can make recommendations about what I can do to bring or enhance your smile, but at the end of the day, I would never tell someone I don't like your smile or I don't like this, I don't like that. I can make recommendations on what I think would be nice on you if it's something you are interested in and taking part of, but I would never tell someone you need veneers, you need this, you need that. It's more general recommendations from a friend to friend basis, really.
What's a top misconception about veneers that you hear all the time?
Yeah, so a few misconceptions actually. So one, turning teeth into little nubs, little pegs, and I think the term was turkey teeth from what someone mentioned. You know, that's something that unfortunately is not the case. Not to say that that doesn't happen. It still happens to this day, but you know, if it's a very well done veneer, you want to try to remove as least amount as possible. None if possible, right? And it's very case selective, but you try to preserve as much tooth structure as possible, and that's not only what makes the veneer last longer, but it's also what makes the veneers look more aesthetic. So that's probably one of the biggest misconceptions. And the second one is, of course, longevity, right? When people think veneers last forever, not true. There's a lot of maintenance that's involved. You have to brush, you have to floss, you have to wear your night guard, and yes, if you do the following, then it's gonna last you years and years and years.
How many are we looking at? A couple of decades?
So if you look at the common literature, or we're looking at 15, 20 years, but there are veneers who last 40 years, more than 40 years, and there's just some that last about a year. And the reason why there's such a big difference is, yes, there's a lot to do with how the veneer was made, but it also has to do with hygiene and how well it's kept, right?
Right. So a same quality veneer could last 2 years because they're not taking care of them and they just have bad hygiene. But then another person doing everything right could make it last 15 years, right?
Absolutely, absolutely.
When you're designing, your patient smile, what's the biggest influence that you're looking at? Is it their face structure? Is it their skin tone? Like, what are those things? Can you talk a little bit about that?
Absolutely. It's everything. You know, when I'm saying everything, I'm looking at, as an example, their skin tone, their lip profile, their eyes. When you're designing a smile, you want that line from eye to eye to be parallel down to the smile. You're looking at the midline. You're also looking at personality. You know, when you're designing someone's smile, the more dominant someone is, the more masculine someone is, the more pointy and square I like to design it. The more feminine someone is, the more rounder I like to make them. So it's not a one fit all. I look at everything, and that's why I take so many pictures to analyze and make that smile design, is because I'm taking everything into consideration.
So, for our audience listening who doesn't know anything about your industry, are you taking photos of a patient, putting that into your computer, and actually designing as if some architect was designing your house, and then doing those treatments? Can you walk us through that process a little bit?
Absolutely. So I like to take at least 12 different shots, right? Now each shot can be, I might take five of them.
Okay.
Might even take more. So I like to start off by taking lots and lots of pictures from the face shots, from the smile, everything being retracted, the side shots. And once I take all these shots, I'll actually like to upload them into a PowerPoint. With that PowerPoint, not only can this help me walk patients on what I have in mind, but from that PowerPoint, I can have designed a wax up. And essentially, what a wax up is that you take someone's teeth, right? You take imprints of it, you turn it into a model,
Right.
and then you can add a wax to it and what you think is the ideal smile should look like, right? So that can be done physically, it can be done on a computer with a software called ExoCat. There are different ways you can get to that. But this helps us communicate better with the patients on what is it is that they're trying to achieve, so that not only is there better communication with the patient, but it also helps us design the model. And then once all that is done, I prepare all the teeth, and then I take even more pictures of the temporary. Why? Because I like to use the temporary as a guide to make sure that they like what they're getting, right? If they tell me it's too bright, or if it's too dark, if it's too long, if it's too short, if it's too pointy, if it's too round, I can specifically change it in the mouth so that there's no miscommunication. So that when we get to the end point where we have the veneers ready, it's exactly what they want, right? Because they're a duplicate of the
Right.
temporaries. So I take a lot of time to take a lot of pictures, sit step by step to make sure that people are really getting what they want, right?
Is it a few hours, few days that you spend before going from the initial shots to actually performing the surgeries?
Right. I mean, it could be the day of, right? So I can take the pictures early in the morning, make the wax up during the day, and then start prepping at night or midday. But to be realistic, to make sure things are done very well, I do like to take my pictures on day one, wait a few days, analyze the pictures, and then the same time I can design the wax up, and after a few days, and then start prepping after the third day or fourth day. So it really depends on also people's travels. A lot of people come from different countries, different states, and we can make things happen. But for the average Joe, I would say, to answer your question, it would be probably about a week apart from the moment we're starting the pictures and then the moment you start the actual prepping.
Okay, that's fair. What is a good candidate for Veneers versus Invisalign?
Yeah, so it depends on, again, what you're trying to achieve, right? If you're looking at closing gaps, correcting the bites, you're looking at getting the teeth straighter, and if you already are happy with the shape, the color of your teeth, I would say Invisalign would be a good fit. If you're with the beauty with veneers is that you can do a lot of that as well, where you can correct the bite, you can close up gaps, you can enhance the shape, the size, the color. Oftentimes, actually, I like to use both. And the reason why I like to use
Right.
both is because I like to use Invisalign first, get them, not necessarily get them straight, but also correct the bite, because that will make the veneers last a lot longer. And then if the teeth are already straight and if they're already well positioned, I actually don't need to remove much enamel. So it'll actually make the
Right.
veneers a lot less aggressive. So I do like to combine the two together.
What is the biggest mistake patients make before actually seeing someone like you?
So I think having unrealistic expectations. I think going on social media, I think it's great. I actually think it's encouraged to look at work and see what's possible, so you can better communicate that with your dentist. But I think to answer your question would be to, take someone else's picture and say that I want exactly the same thing. We can probably get something that's close to it using the same lab, the same material, the same proportions, but everyone's teeth are different, and it's important to make sure that that's clearly communicated.
Do you ever tell someone you don't need veneers?
Yeah, I mean, I never want to be in a position where I tell someone what you need, what you don't need. I don't want to tell someone, I don't want people or patients to feel like they're not understood. I don't want them to feel like they're not
Right.
valued, they're not understood, and they're not listened to. But probably in a very nice way, I would try to find out what is it that they're trying to accomplish, right? They may be thinking veneers, thinking that's the only option, but there might not be aware of what other options there are, right? If there are white spots on the teeth, there's something called icon that can remove it. If it's just the color that they're not happy with, maybe a little bit of whitening and recontouring would do the trick. So I would more try to understand what is it they're trying to achieve, and not necessarily disregard that.
I'm guessing you also do Botox for like, dental aesthetic plans, right? Is that like I'm trying to think, where do you draw a line between, dentistry and actually, you know, facial aesthetics? Because now we're lifting the entire face, right? Is that a challenge, or
Yeah,
how do you
of
deal with that?
course. So I like to do, I love Botox, right? I think it's something that really enhances someone's profile in a lot of ways. And I'll give you examples. Like, so if someone comes in, I've had a patient who had Bell's palsy. One of her lip was a little higher than the other. And what the
Okay.
Botox did was I just dropped it down a little bit so that now it's more symmetric. I also have patients who clench and grind a lot, right? So by doing Botox on ambassadors, not only do you get them out of pain, but also makes them clench and grind less, which actually makes the work that we did dentally last a lot longer. Do of course do a little bit of facial aesthetics here and there, but in terms of where to draw the line, I mean, I don't do fillers. I don't do anything that's below the neck. Even when it
Okay.
comes to facial Botox, I mean, I do it here and there, but very, very basic. I would really like to try to focus more on anything that's oral.
One of patient story I found while researching, for this episode was a patient went on to get a, treatment after a breakup, right? Because they just felt that would lift them up or cheer them up. Do you get stories like that because they just think this is an emotional thing they can do to improve their life?
So of course, I mean, of course, I would say even like divorces, especially. But I don't want people to think that this is the key out, right? This is the solution for the trauma, but it does help a lot in terms of restoring someone's confidence. You're asking, do people come in with a lower level of confidence, wanting a little bit of a tune-up? Of course, right? It's life-changing when you change someone's smile. So to answer your question, yes, we do get stories where people come in.
I think I'm sorry to interrupt, but I think what I mean is, if somebody does, you know, objectively have a problem with their teeth, right? Like you said, there are gaps. They come in, they're going to get a confidence boost. Absolutely brilliant, right? That's the right thing to do. But I'm more thinking like, you had a breakup, you got a haircut, and now you think this is going to fix, like, how, I don't know, like, because I've read those stories and I know those people do exist. What do you say to them? Have you ever had a patient where you're like, you don't need anything, you need a boyfriend, right?
You know, when you're asking that question, there's actually one person that comes to mind where,
Okay.
and it was specifically about a breakup. He came in and um, such a nice guy. He was actually, but he was relatively young. He was in his early 20s, and he was looking for a bit of a confidence boost. And he sat down and just very emotional. And I remember him saying that his girlfriend didn't like him for, it wasn't necessarily for his teeth, but he made a lot of comments about how she didn't like about the fact he had bad breath all the time, and he felt like that's something that caused a lot of insecurity. And So it wasn't so much the dental aesthetic part, but rather it was more the odor part that was really bothering him, and it was making him very self-conscious about it. And of course we give him a couple tips, a couple tricks. We went over hygiene. He had a cleaning done with our hygienist. There was plaque that was causing a lot of these um, the stress. So it wasn't necessarily aesthetics, but it was someone who came in roughly insecure about their, not necessarily about their smile, but about their hygiene, and they were seeking for help. You know, I don't know if that answers your question.
No, of course, it does, but I just got a quick follow up. If somebody comes in and you think they don't need anything aesthetically, do you just want to give them some tips and resources, and you're like, just work with that? Do you have any tips for our audience?
Absolutely. So people come in wanting something that, and I usually try to find out to see what is it that they want, right? Because if someone comes in saying I want veneers, then I'm like, okay, well, what are you trying to accomplish, right? There are times where
Right,
I don't believe that they need veneers, right? There's sometimes where there are times where I'm like, all right, well, if a little bit of whitening and a little bit of bonding, it will do the trick and you're done, right? And you don't need to go as extreme as doing something as along the lines of veneers. So yes, there are times where someone comes in with very nice teeth wanting veneers, and they really try to understand what is it that they're trying to accomplish. Because yes, there are times where I don't think that they need veneers. You know, I think there's something that can be easily accomplished with just a little bit of whitening, right? But
right.
remember, there's always a reason why someone comes in and visits you, right? If there's a reason why they're not happy with their current smile and their current teeth, and it's important to find out to see what is it that they're not happy with, right?
Well, if you mentioned this particular patient about bad breath, right? If somebody comes in with this specific problem, I just have really bad breath. What are some tips you can give them without actually going into a lot of treatment?
Right. So one of the most common reasons to bad breath will be, of course, if there's a lot of plaque on the tongue. So I guess my first question is, are you using a tongue scraper? Right? Because that alone is very important. I know sometimes people come in, they're like, well, I brush my tongue, and well, that's not enough. Because when you're brushing your tongue, you're just moving the plaque from one area to a different area. And it's always important that when you're using the tongue scraper, you're going all the way in the back of the tongue and then pulling it out. And that's really what removes the plaque. The second question I like to ask is how often are you flossing, right? If you're just brushing but you're not flossing, then tiny food particles can get stuck between your teeth, and that's what harbors bacteria, and that's what can also emit bad breath. There are also a lot of medications that can also contribute to it as well, but usually the most two common ones are the ones I just mentioned. So I really try to find out to see or and learn more about their hygiene. When was their last cleaning? Are you still getting regular cleanings done so that I can help both?
Well, you mentioned scrapping, but a lot of time when people brush, they do brush their tongue. Does that not help? Or because, is that not the same thing? I understand scrapping is a little more intense, but if somebody is listening and they're like, I brush my tongue, is that enough?
So the answer is absolutely not. Because when you're brushing
Okay.
your tongue, you're just moving the plaque from one area of the tongue to a different area of the tongue. But when you're using a scraper, you're really removing all that plaque, especially when you go all the way back and you're pulling it forward. You're really removing all that plaque.
And do you recommend scraping to be just once a day kind of thing, right when you're brushing? Or is it like if you have bad breath, start doing it, but maybe then move to, I don't know, once a week or whatever?
All right, so definitely, I would definitely not recommend once a week. I would do at least once daily or twice daily. The more the better, right? Because as we're eating food within 24, 40 hours, plaque starts to develop. Um, the more you do it, the better. I don't want to tell patients you have to do 10 times a day, but if you do it twice a day, I think it's a very fair number and realistic number.
That's fair. Because I think everybody brushed their teeth, but almost nobody, you know, scraped their tongue, right? So, because our audience is an average person trying to live a healthy life, right? And I'm thinking from like an average person's standpoint who is just living their life, brushing their teeth. They're not thinking those things. So this is very helpful. Before we move on to the next segment, I want to talk about social media and your brand you've built because you've done a fantastic job at that, right? Before we move into that, do you have any comment on the fluoride toothpaste? Because that's one thing I'm really, you know, looking into. I recently interviewed Dr. Nathan Bryan, who's working on products with nitric oxide, and he made a comment the other day. Was like, if you look at your toothpaste and it has this one particular chemical he mentioned, and he says you go to Home Depot, you pick up rat poison, it has that exact same chemical. So you're basically brushing yourself with poison. Do you have a quick comment on fluoride in the toothpaste or anything in those lines?
Um, so this is one of those questions where I'm like, no comment. We'll cut this
That's
off.
fair.
And I'll say,
No, that's fair.
and
I
yeah.
I really don't want to get into things which you think are controversial. Some doctors are like, you know what? I'm an anti-vaxxer. COVID was a hoax, all of that. And some people are like, look, I have a very specific knowledge and I want to talk about that, and I'm happy with that. But I just figured I'd ask you, and it wasn't even part of our
So
questions,
no,
right?
you're fine, you're fine. And it's something that personally I like fluoride, right? And there's a lot of literature,
Okay.
a lot of good literature, and I like, but I know there's so
Okay.
much stigma associated with it. So it's not
Oh, yeah.
something I want to talk about.
You know what? This is what makes it so much fun for me because I'm not a doctor, right? And I listen to these doctors like yourself and Dr. Nathan Bryan with 10, 20, 30 years of experience, and they're saying the opposite thing. And now I'm sitting here thinking, okay, well, this is where the fun begins, right? Anyways, let's move on to social media, education, and brand building, because you've done a really good job at that. When did you start posting on Instagram and why?
So I actually started in the fitness industry. So back then, I actually had nothing in dentistry posted. I would do a lot of physique competitions, get featured on certain
Okay.
magazines, do fitness competitions. I even am also NASM certified, which is a certification for personal trainers as well. I used to have my own brand, my own website for personal training. So it really started in the fitness space. Even, and then eventually when dental school happened, I tried to combine both elements of fitness and but also dentistry and combine that work-life balance. Both extremes, so waking up 3, 4 in the morning, eating 6, 7 times a day, um, working out, and then competing professionally and actually, and then of course the dental ward, where you're also studying all these long hours, you're in the clinic, you're seeing patients, and I try to mesh the two together. So my space actually started from that, and I
Right.
kept that space throughout all of undergrad, dental school, and then residency. And then when I started working, I'm like, it's hard to keep that professionalism,
Right.
right? So then I started removing a lot of those pictures and videos from the fitness end, and then eventually started to shy away more from the fitness. And not to say that I still don't compete, I still do, but
Right.
just in terms of branding, I started shying away from the fitness, turned my website down eventually. Still have a few pictures and videos, but tried to gravitate more towards the dental. But that's how it started.
You got a big audience. Do you think there's anything people misunderstand by looking at your social media?
Yeah, I mean, people probably would look at it and look at the glam, celebrities, the makeovers. I mean, I think what people don't understand is the work that goes behind it, and
Oh,
also and also all the things you have to do that are not glamorous, right? The long hours, the waking up at 3 in the morning, 2 in the morning, studying, um, error, and trial and failure, and a lot of the things that people don't take into consideration, right? They just look at the success, right? So
right.
there's a lot of depth that comes to it that's not shown on the social media. So I think that's a lot of things that people don't understand is truly the level of work that came to get to this point, you know?
You treat celebrities, you do the aesthetics, you make people look pretty. Other than that, you're also doing things in Hollywood. Are you willing to talk about that?
Yeah, yeah. So my passion is cosmetic dentistry, right? I love painting people's teeth, I like changing people's smile. It doesn't, I mean, celebrities sure come in every now and then, but at the end of the day, just that alone, changing someone's smile is really what gives me a lot of passion, celebrity or not. But as far as like Hollywood, we actually shot for a TV show that's going to be coming out in the next 2 months called Legacy Makers. You can check that out. And then it's going to be on the major platforms. And it's really a story about my childhood, everything and everything in between to what it took to get to this point. And that's something that's going to be airing in the next 2 months.
So the show is called Legacy Makers, and they're doing an episode on your life and how you have built everything. Oh, that's so awesome! I can't wait to see it. Where did you guys shoot that? Was that in Beverly Hills?
No, so it was in Miami. So I
Okay.
flew to Miami for a couple of days, got the footage in, got the shots in, and was able actually, God bless my mom, I was able to get a lot of footage from my mom as well, from when I was a kid. So we try to incorporate all of that onto that episode. So it's going to be nice. A lot of good footage that's been gathered.
If somebody is looking at your brand, it just seems picture perfect, right? Everything's so pretty, everything's perfect. You are a very good looking person. Do you feel pressure to always post like perfect photos and reels and videos? Or do you not care and it is what it is?
I don't really care.
Yeah.
I think, you know, in terms of what I post, I think just like any other human being would put their best foot forward on social media. So what I post are things that I like, I'm proud of. I like the work that I do, the people that I meet. But as far as pressure, I mean, not really. I just like to do I just doing what I love, and I don't really look at the noise or the people around me.
Social media is a funny thing, right? Because people are watching all these clips and they're getting excited and they see what's possible. But is it also creating unrealistic expectations where, no, you're never going to look like Hailey Bieber, right?
I think there's definitely a lot of elements of not realistic expectations just because everyone's biology is different. It doesn't mean we can't get you to something close, but everyone's lips are different, jaw is different, facial profiles are different, gum levels are different. So even though artificially we can mask it and try to get someone to get to that point that's roughly close to it, it'll never look identical because everyone's biology is different. So yes, there is a lot of unrealistic expectations.
When we started talking, you mentioned turkey teeth, right? And can we talk about that? What's that term? Where does that come from?
So I actually don't want to. Let's rephrase this thing a little bit, and and
Okay,
and I'll explain why I don't want this on a podcast because
sure.
so turkey teeth, I'm assuming came from the country Turkey, right? Where a lot of people
People
are there
flying to Turkey.
Turkey and
Yeah,
then get their work done, and then teeth turn into
yeah.
little nubs. So I think if you want to maybe talk about this on the podcast, I would maybe say why do people like come in with like because like people also allude them to like little nubs, right? Like teeth turning into little
Right,
nubs, or like shark teeth, right? So I think there's
right.
turkey teeth and shark teeth. So if you want to talk about this, I would maybe say like what is like shark teeth? Like what do people mean by shark teeth as far as turkey teeth?
I see.
Yeah, just because I
Yeah,
want to
we
go ahead.
yeah, no, I get it. It could be. It, I see what you mean, right? Because you're kind of looking at a country and where somebody could be flying to Pakistan for the same treatment, and we're calling them turkey teeth. It's kind of a little bit racist, if you will. Not really, but yeah, no, I get it. I'm just gonna ask you the question again, so that we can eliminate that part and start with like, what's your take on shark teeth? right? That's the trend we talk about.
Yeah, so I think what people allude to when they think shark teeth is our teeth that are turned into little nubs, right? So when you get a veneer, a crown, when you have to prepare the tooth, you remove a little bit of the enamel. There are times where you can get by removing none if possible, and it's very case selective,
Right.
but oftentimes you have to remove just a little bit, right? Now, there are also providers out there who turn teeth into what we call a shark teeth, which are essentially little nubs. Now, the reason why I think that's very heartbreaking is because there's no going back. You know, you can't regenerate enamel once that's done. And quite frankly, I've seen a lot of patients getting their work done either abroad or by different dentists, and then they come back with a lot of pain, lots of sensitivity. Then now they need 8, 10 root canals because there was too much cutting, it was too aggressive. So it's something that it's so important to make sure that the dentist that you're seeing is someone who is well skilled, especially when it comes to veneers, so that you don't end up having a lot of problems afterwards.
Is there a dental trend that you don't like that's been going on, or is this what we just talk about?
I think one of the trends are probably the fact that veneers last forever. I think people look at veneers or even implants really as once you get it done, you're done. You're good for life. And I think it's a trend that has been growing as well. But the reality is it's that it's not true. You know, veneers can last more than 20 years, but there are also some that last only a year. And the reason why there's a huge spectrum is because it depends on hygiene. You know, it depends on how well are you taking care of them. Are you seeing your dentist regularly for visits? Are you still flossing? Because decay can still form around them if you're not flossing well. So, and are you wearing a night guard? If not, it can chip. So that's probably one of the biggest misconceptions and trends that are going.
Have you ever had to redo somebody else's work?
Oh yes, at
Yeah.
least 2 times a month. Yeah, I've had.
Oh, really?
Yeah, I've had. And it's not necessarily something that was done recently. I mean, there are times where patients have had veneers done many moons ago, and then it was just time to change them up. Either they weren't happy with the level of aesthetics, or there was decay around them, or they got a lot of recession, and then the tooth was showing, or they were just not happy with how it turned out, and it was maybe done years ago. And there are also times where patients just had them done about a year ago. You know, fairly recent where they just weren't happy with the level of aesthetics. So, and then I just went ahead and changed them. Now, when you're changing veneers, it's a very aggressive process, right? Um, because not only do you have to remove the veneer, but you also have to remove a little bit of the natural tooth as well, right? Or at least
Right.
fix the natural tooth. Why? Because if you don't, then it's not going to stick well, right? It's not going to bond well. So, and you can only imagine the pattern of consistently changing them over and over
Right.
again, right? So usually it's not something I recommend unless it's a necessity.
Do you think there is such a thing as overdoing cosmetic work?
Yeah, I mean, definitely the whole idea of trying to chase perfection.
Right.
I think a prime example would be someone coming in and they're like, "Look, I want whiter teeth." I'm like, "Okay." So then we do a little bit of whitening. And they're like, all right, well, I want a little bit of length. Then we do bonding. And then they're like, well, you know what? I also want these lower ones also corrected, right? So then we do Invisalign. And then they're like, you know what? I actually want to change my proportions. I just want, now I want veneers. And it's like you're consistently chasing that level of perfection higher and higher and higher. And then too much of anything isn't good, in my opinion. But that's why it's so important to really sit down with the patient, see what is it that they want, what is it that they want to get fixed, so that we don't get to that point of consistently chasing to perfection, but we get to that on day one, right? We get into that level of perfection at the first attempt.
What's your take on these at-home veneer kits? Because I've been seeing a lot of those in TikTok, and I was like, no, it doesn't sound good. But let me ask a professional.
Oh man, I think probably one of the most common trends that I've seen, at least in the last few months, are like veneer techs. Um,
Right.
I think has something to do with them using a derivative from or acrylic from the nail, from what I remember and what I've seen. Man, luckily, knock on wood, I haven't had a patient come in with that in the mouth, and for me to fix. Knock on wood. But it's heartbreaking, man, because the material a lot of times is cytotoxic, and it's they don't take into account the function, the bite, the hygiene. The materials that they're using oftentimes are not biocompatible. They're toxic, and patients come back with pain, with sensitivity, and it's not worth it, man. You know, you're saving a couple bucks here and there, but then you have to pay more trying to undo the work. So it's
Teeth is such a sensitive thing. I mean, as much as our teeth are forever and they last a lifetime, but it's one of those things. If you mess up, going back is just impossible, right? There's no replacement for a lost teeth in your 30s or 40s, right?
right, right.
Just
You can't regenerate teeth for sure. You,
exactly.
you gotta be.
All right. Well, this is good. I've got a rapid fire round for you. We've got few questions where these are just for fun. I don't really want you to think about it. If you just answer them, whatever comes to your mind, that's like the right way, right? You ready? If you were not a doctor, what would you be?
I would definitely be some form of an artist. You know, if it's not a cosmetic dentist, I'll say plastic surgeon. If it's not dead medical, I would say like a painter.
Oh wow, interesting. Veneers, do you think it's natural look or Hollywood shine?
Oh, it has to, in my opinion, natural look. That's what makes it fun.
One dental trend you wish would go away right now?
Ooh, probably the circling back to veneers last forever.
Most underrated part of Smile Makeover.
Most underrated part. Hmm. I would probably say the function, like the bite. If you don't take into account the bite, the whole smile makeover is not going to last you a long time, right? So you have to make sure you have a strong foundation.
Interesting. Yeah, I didn't think of that. I was like, you're doing a Smile Makeover. As long as it looks good, who cares about the bite? But that's awesome. Good to know. A celebrity smile that you admire personally,
So it's smile that I want, sorry?
that you admire.
Billy Bieber.
Oh yeah. Well, you can't blame your patients then, right? That's awesome. Best toothpaste ingredient that people ignore.
Definitely arginine. Arginine has been shown to not only help with decay, but also reduce sensitivity.
Awesome. Teeth whitening strips, yay or nay?
Yes, but it depends on your starting point. If you have a lot of good enamel, healthy teeth, then yes, they're going to work really, really well. Even the Crest White strips from over the counter.
Right.
But if you're in dentin and you lost a lot of enamel, then no, they're not going to work as good.
What's your favorite step in the smile design makeover, the whole process that you do?
Definitely the first appointment, where I'm gathering all the information and trying to get to know the patient or personality. Second
Right.
favorite is the temporaries. So when I put the temporaries in for the first time, and when I hand them a mirror and see their reaction, oh God, it's so nice. So hands down,
What's one thing you never do to your own teeth, but you know a lot of people do?
charcoal. I
Sorry,
don't
what was that?
charcoal, like using
Okay.
charcoal
Yeah.
for whitening purposes. I think it's very abrasive. Don't think I don't personally recommend it.
What about gum coating? Do you like it or do you hate it?
Oh, I love it. I think it's
Yeah.
huge. It's something. It could be something as simple as gum recontouring that can really change someone's smile, especially if someone who has a lot of gum display and not enough tooth showing, but just lifting up the gums a little bit. Not only do you make the tooth
Right.
look a little longer and more youthful, but it's very life changing. So love it.
Is there such a thing as a red flag in a smile?
Um, Not a red flag in a smile, but more so red flags in someone's expectations of what they want. I've had someone come in with beautifully perfect white teeth and they're like, I want veneers all around. And I'm like, why? What are you trying to accomplish? What are you trying to
Right.
accomplish? It was funny, actually, funny enough, I got to stop you here. This very same patient came in with a cast because she just got her nose done. She had
Right.
her jaw fillers. She had her lips done and she had, of course, her Botox, and then I just saw red flags all over. But
Yeah.
so that was funny.
What's one thing that makes a smile instantly more attractive?
I would say underrated, but actually lip profile. You know, when you actually have a good amount of lip volume, it actually enhances your smile a lot more. If I were to compare two smiles, both of them having identical teeth, but one of them
Right.
has more lip volume, believe it or not, the one with more lip volume will look a lot more aesthetic. Now, I'm not saying to get fillers, but I'm saying that to answer your question, that's generally what makes it a
Of
little bit more
course.
aesthetic.
Right. Is there a dream client that would you would love to do a smile makeover for? Is there like a dream client or a celebrity that you would want to do a smile makeover for?
Not so much because they need it,
Yeah,
but I've always loved Arnold Schwarzenegger growing up, and it's really because of the whole fitness industry. So
that's what I was gonna say.
yeah, definitely, it's not so much to do it; it's more so to spend time talking to him.
There you go. Night guard or no night guard? What do you recommend the most?
1000% with night guard. That's really what's gonna make or break not only your veneers, your natural teeth, but it's really the secret sauce to longevity and to keep your teeth healthy. Now, one of the reasons why people come in wanting veneers or crowns is because your teeth have gone shorter over time from the clenching and grinding that occurs year after year. So
Right.
the night guard will be the secret sauce to really keep that high in aesthetics from a very young age.
What's worse for teeth, soda or stress?
A little bit of both. And in different ways because then with stress you're clenching, you're grinding, and that takes a lot of the enamel off, right? You're compromising your teeth. They can crack, they can chip. You're causing a lot of wear and tear. With sodas, I mean, the acidity can also cause a lot of erosion on your teeth, right? And if you couple the two together, the stress and the erosion, it's a recipe for disaster.
Yeah, that is a disaster. A little side note, what about coffee? Is that also as bad as soda or?
No, absolutely not. Especially if it's black coffee. Yeah, it can stain your teeth, but if you brush your teeth right after, or if you drink water after to neutralize the pH and just remove the stain molecules, then there's actually no harm, really. It's really after years and years of years of drinking coffee and then not drinking water after it can stain them, but not necessarily for compromising the health of your or the integrity of your teeth.
Last question. What's your favorite compliment a patient ever gave you?
So the favorite compliment a patient would get from someone else or from me?
No, the patient that gave you, like after you did their work for you.
I think the biggest compliment I've ever had was when them saying, like, I've been able to smile again. And this actually happens very often where people come in and they just don't know how to smile. And and usually when I ask them to smile, they just don't know how. And if they do, they go like this. So I think them saying after the follow-up visit of them having the veneers for a week and then saying I've been I've been now able to smile and really a lot of like positive energy. I think that's what really is the best compliment anyone can give about my work.
Maybe I am a bit naive, so please excuse me for this question. So, are you saying there are patients or people that live their entire life without ever having a fulfilling smile?
Like not having a fulfilling smile.
Yeah, like they just don't know how to smile.
Oh, 100%. And it happens all the time where
Wow.
people don't know how to smile because they're either embarrassed of their smile or they're insecure about their smile. So either they would have their hand in your mouth when they're smiling or speaking, or they just wouldn't display teeth when they're smiling. So yes, it happens very, very often.
Well, you're doing God's work, man. This is, I can't imagine, somebody just not smiling because they think, they're just insecure, right?
Yeah, yeah. I mean, I'm very blessed to do what I do, and I love it.
Well, this is awesome. Thank you so much for doing it. Where can we send our listeners to follow you? I know you're big on Instagram. I'll link your Instagram to it, but where would you like our audience to go find you?
Yeah, I think Instagram is probably the most used one. I mean, I can give you my email as well, but I think Instagram is just hands down. It'll be the most easiest platform to get a hold of me and communicate with me.
Awesome. Great. Well, this was great. Thank you so much, Doc.
Very welcome, man. Thank you so much for having me today.
Yeah, I'm